Hi, welcome to Basic Life Support and Airway Management Made Easy. Yes, we're going to be looking at basic life support. Cardiac arrest is a leading cause of death in the United States and even in our environment. So, when we say basic life support talks about what you do to help the heart to keep contracting and to keep supplying blood to the brain. And we understand that early initiation of basic life support shows an increase in the survival probability. So, what is basic life support? So, this is a sequence of procedures performed that helps to restore the circulation of oxygen after a sudden cardiac arrest. And it does not include drugs and invasive skills. Remember, when you're talking about drugs and invasive skills, what you're not talking about is ACLS. Yes, advanced cardiac life support. So, what is the purpose of CPR? Why do we do CPR? We do CPR to maintain circulation and oxygenation, and this will help to keep the vital organs alive. So, what are the indications for CPR? Please don't forget there are three indications: cardiac arrest, respiratory arrest, or both. Cardiac arrest, commonly seen in adults, respiratory arrest, commoner in pediatric, and both is also can be seen. Now, there's something you need to take note of. For normal resuscitation, we say we use the ABCD approach, but in cardiac arrest, we use the CABD approach, the CABD approach. So, cardiac arrest, you emphasize first on circulation, airway breathing, then you defibrillate. So, the chain of survival. Please take note that the adult chain of survival now is 6, unlike the previous one. The 2020 guideline, AHA guideline, shows that a sixth column has been added, which is recovery. So, after activation of emergency response, performing early CPR, defibrillating with AEDs, advanced life support, post cardiac arrest care, there is recovery. So, this is the 2020 CPR guidelines, and what it hinges on is the importance of early initiation of CPR. And this is important because we know that the earlier CPR is initiated, the better the chances of survival. There's even a CPR only BLS where someone is only applying CPR. And also see the CIS-link recovery. This recovery is important because it's been noted that recovery from cardiac arrest continues after the initial hospitalization. So patients may have formal assessment, support for their physical, cognitive, and psychosocial needs. Now, the 2020 guideline also talks about the CPR coach. What is the function of the CPR coach? The CPR coach helps to promote delivery of high quality CPR. What does this CPR coach do? He stands beside or just next to the feedback display across the compression, and he verbalizes the data from the feedback, and he also gives corrective feedbacks and coordinates the initiation of pulses in CPR, and he tries as much as possible to keep all the pulses within 5 seconds. Remember, in effective CPR, we said that pulses should not be more than 10 seconds. So this CPR coach aims at keeping all pulses within 5 seconds. So this is the adult BLS algorithm, starting with a patient that is unresponsive to calling 911 and getting an AED. You assess for pulses, and then you begin CPR. Basic life support. So, what does the basic life support emphasize on? The first thing is scene safety. You want to make sure if your scene is safe. Safety can come in various times. We know that some environments may have violence. And also, if it's a fire incident, you wouldn't want to start CPR where you're also exposed to fire or somebody that is drowning. You definitely have to bring the patient out of the water. Also, safety will also deal with infection control. So you also want to know, oh, am I at risk of infection? Do I need a PPE? Do I need my gown, gloves, goggles? Now you check for response. So the first thing you do after checking for safety is response. You want to know, is my patient responsive? If your patient is responsive, then it's not BLS. You're starting with the ABC of resuscitation. But if your patient is not responsive, then you start with BLS. And an unresponsive patient, the next thing you do is call for help. Activate emergency response and get an AED. Once you activate that, you check for pulses and breathing. Remember, the pulses we use is a carotid pulse. Now you check for pulses not less than 5 seconds, but not more than 10 seconds. Then you check for breathing. You'll feel and look for the chest rise, the movement of air in and out. Immediately you commence CPR. CPR for adult is 30 compressions to 2 breaths, and for pediatrics is 15 compressions to 2 breaths. And each breath must last over 1 second, and you must watch for visible chest rise. Now use your AED once it comes and assess for reading. So take note of the location of chest compressions. Chest compression is usually done in the lower 1/3 of the sternum, between the nipples in the midline. Yes. Please take note, and take note of the interlocking of the hands. Now, hand positioning and arm positioning. You must make sure that your elbows are straight and they are positioned directly above your patient. And you use the upper body weight just to push straight down. Remember, the compression should be approximately 5 centimeters or 2 inches, but not greater than 2.4 inches. What is good quality CPR? Good quality CPR emphasizing on pressing hard and fast, allowing for full chest recall after each compression, and minimizing interruptions during compressions. So after taking note of your C, you go over to your A, airway and breathing. So for breathing, there are different ways. You can use the mouth-to-mouth rescue breathing as mouth to nose or mouth to a stomach. There's also ventilation with a bag mask, and there's also ventilation with advanced airway. So when you want to maintain airway, the first thing is you want to make sure is the airway patent. You understand that if the airway is open, different things, you must open the airway using the triple maneuver, the head tilt, the chin lift, or the jaw thrust in case of cervical trauma, and open the mouth. This is a triple maneuver. Also, other things that can block the airway is secretions or blood. So you may want to suction the airway using a Yankauer suction. Now you want to maintain the airway using basic airway adjuncts like the oropharyngeal airway or the nasopharyngeal airway, which you also must measure. For the oropharyngeal airway, you are measuring from the angle of the mouth to the angle of the mandible. While for a nasopharyngeal airway, you are measuring from the nares to the tragus. Other supraglottic devices you can use is the LMA, the laryngeal mask airways, or the oesophageal trachea airway. Or you may want to go for an advanced airway, which is using the endotracheal tubes. Now for ET tubes, you also want to check the sizes. Adult, the commonest size used in adult female is size 7, while adult male is size 8. But for children, you want to check the size by measuring the age over 4 plus 4. And it's advised for you to always take a size that is 0.5 above and 0.5 below the estimated size. You also get other airway instruments like the laryngoscope blades, either the Macintosh or the Miller. The Macintosh is commonly used in adults, which is curved, and the Miller is commonly used in the pediatric folds, which is straight. And the laryngoscope sizes, the 4 and 3 adults, 2 children, 1 unit. You also want to confirm the placement of the tubes. After watching it pass through the vocal cords, you want to confirm using a waveform capnography. You may also want to confirm using a colorimeter device, esophageal detector tubes, condensation in the tube, or auscultation of breath sounds, chest X-ray confirmation, and vital signs. These are the different confirmation tools for ET tube placement. Remember, for your bag mask ventilation, you use the CE technique, where you form a C with the mask you're placing over the mouth and the nose, and you form an E by elevating or opening the airway. After which you apply the defibrillator, the automated external defibrillator, and you follow the prompts. The first point always in an AED is to power on the AED. Then you attach the parts as shown in the picture below. Now you check for rhythm, check. If it's a shockable rhythm, you deliver the rhythm. If it's not a shockable rhythm, you continue your CPR. After which, when your patient returns to rescue, place your patient in recovery position. The complications that can come from CPR is rib fracture, when you overzealously compress and fracture the ribs, most times when you pass a depth of 2.4 inches. Other complications can be laceration related to the tip of the sternum, vomiting and aspiration, gastric distension. Remember the algorithm where you say a patient is unresponsive, no pulse, no breathing, call for help, get an AED. You begin chest compressions, 30 compressions to 2 breaths. Apply the AED parts while you defibrillate or you continue CPR. While you do this, you wait for the ACLS providers. I hope this is